There has been more debate over medical marijuana than any other drug in history. If once a harmless weed turned into an illegal drug, medical marijuana is not only cost effective, but it's also easy to produce. It can help with a variety of medical conditions, including serious ones like cancer. Medical marijuana helps cancer patients deal with the symptoms caused by chemotherapy. Those prescribed medical marijuana claimed it worked much better than any other drug. Even though marijuana has helped so many people in states that have legalized it, the federal government still refuses to legalize it on the federal level. Not only is medical marijuana good for its patients, it's also good for the government. According to the Huffington Post, Colorado marijuana sales have reached nearly $1 billion last year. The market for marijuana is booming, and still the federal government refuses to acknowledge it. But what are they so afraid of? Is a weed really worth all the hassle if it's actually helping people? Painkillers are one of the most prescribed medications in the United States, and are also used to treat symptoms of illness such as cancer and for surgical procedures. Due to the growing number of prescribed medications, also comes the growing number of addiction to painkillers. According to ASAM.org, approximately 2 million Americans are addicted to painkillers. Medical marijuana could be the solution to this problem. Not only is it non-addictive, it has also been observed to provide pain reduction benefits similar to those of a powerful opioid. It also has properties that help people with inflammations and nausea. It can also help promote hunger and insomnia and prevent epileptic seizures. According to the drugabuse.gov, marijuana has led to the 2 FDA-approved medications that contain cannabinoid chemicals in pill form. Even though scientific studies show marijuana's benefits outweigh its disadvantages, the FDA still does not recognize and approve the marijuana plant as a medicine. Many states are beginning to disagree with this, however, as more begin to adopt medical marijuana. They are able to agree that marijuana has an effective alternative to modern drugs for certain conditions. The federal government should follow suit and recognize nationally that the practice of medical legalization of marijuana as a legal act, by doing so, will allow patients to finally feel the relief of their medical conditions. The topic was selected because of how it is the topic of marijuana, especially as a medical alternative, has been discussed for many years, where some feel it has a safe, non-addictive way to treat certain medical conditions. Others view it as an addictive drug that in essence is as toxic as heroin. Instead of remaining persistent that marijuana is a horrible drug, they should take a look at what it has done. Marijuana could be used to treat autoimmune diseases such as HIV/AIDS, multiple sclerosis, and Alzheimer's disease. It can also be used to treat mental disorders and substance use disorders, according to drugabuse.gov. Research shows that the use of marijuana can be just as effective as modern drugs, but without the addictive risk of depending on certain side effects. Ohio has passed HB 523, which legalizes the use of marijuana for certain illnesses that are decided upon by the medical board. The bill has set provisions for a special advisory board. The state government will have control over the production and sale of marijuana to reduce potential for crime, and 1-year relationship with a patent will be required for physicians to prescribe medical marijuana. 2-year plan for the implementation of the provisions. Patients can have up to 90-day supply of marijuana at any time. According to U.S. Today, medical marijuana has quickly become the most popular medication for certain medical conditions. The second solution is for the federal government to legalize the use of the marijuana for the medical purposes for the entire country. By doing so, marijuana not only be able to help patients across the country, but the government would also be able to benefit from the passing. Even though there has been so much support for medical marijuana, one of the biggest claims from the opposition is that there is no evidence of the benefits of the marijuana for medical purposes. While there may be no hard evidence of its benefits, there is also no hard evidence of its drawbacks of the drug. According to medicalmarijuana.org, many feel marijuana increases the risk of psychosis, which is a powerful psychoactive drug and can have serious effects on the mind and body outside of its intended medical use. However, research is still being done about this claim, and as long as it's used as prescribed like all other medications, this risk is drastically lowered. Medicinal marijuana can help men, women, and even children. It can help a variety of medical conditions and is more effective than any other drug because it is non-addictive and it is cheaper than other drugs. In order to help these people, your voice needs to be heard. Contact Kashish's office and urge him to make the push with the other governors to push the federal government to legalize the medical marijuana. This plan allows additional revenue to be collected from the regulated processing and sale of marijuana for medicinal use, allowing all states to provide safer alternatives to modern drugs for certain illnesses. All drugs are going to have their advantages and disadvantages. When their advantages outweigh their disadvantages, the drug should be considered. Medical marijuana is a cost-effective alternative to hundreds of symptoms-causing medications. It is safe enough for children to use in a pill form and can generate millions in extra revenue. It is time to stop being afraid of marijuana and accept the benefits it has to offer. If one state can generate approximately $1 billion in revenue in 1 year, I imagine what it could do for the country. What it is the federal government is so afraid of. It's time to make them realize that it is helping people more than it is harming them.